This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Man, am I excited about this episode of Impact Healthcare. And these are two gentlemen that, I haven't known for that long, but now have turned into avid fans. I have turned into fans of them. And now I would say we're kind of comrades in this battle against the status quo. I've got Ashley and Kenneth from Rosen Hotels and RosenSure. Gentlemen, for the 7 people in the world that might have never heard of Rosen and who you guys are, give us an introduction. Ashley, I'll start with you.
Yeah, so we are a hotel chain based in Orlando, Florida. We're the largest independent hotelier in the Southeast. It's a very fragmented market, so we're not a household name everywhere. All of our hotels are in Orlando. We just celebrated our 50th anniversary, and our passion is delivering wonderful health care to the folks that need it at a very reasonable price with high quality.
And you specifically, just as an introduction, you're an insurance guy, but you've been a risk manager. You did P&C. Talk to me about you and your past and what you do for Rosen.
Yeah. So I was the risk manager for Rosen Hotels for the past 25 years. And I also am part owner of an insurance agency, RosenSure, and Harris Rosen, the owner of the hotels, is the majority owner of that organization. And so we've been, selling health insurance the old-fashioned way for many years. And then we started looking at what we were doing for our own employees, providing a much higher quality health care than the Bucas of the world. And we bent into selling that to employers.
Awesome. So Kenneth, give me an introduction to you and maybe filling in some of the conversation of the Rosen Medical Center. And when we say, what does Rosen do for your own employees? Give me a sample of all of the things that are in the program for your own employees.
Yeah, absolutely, Lester. Thanks for having us on. So my name is Kenneth Aldridge. I'm the Director of Health Services for Rosen Medical and for Rosen Care. Rosen has its own primary care facility, which we've had for over 30 plus years. And we all know, everybody on this video know the importance of primary care, where 85% of the care can be provided as long as you got access to it. And that's what Mr. Rosen established. Back in 1991, he got tired of the games that were being played by the Bucas of the world, and he said, I'm going to do it himself. And that's where he went self-funded and established his own on-site clinic. Now, that's evolved over time, as we recognize what is our population? 35% of our population come from third world countries. What is their need? And we started implementing and infusing different services within our medical center to be able to service our population. Again, the diabetics, the hypertensives, the hypercholesteremia patients, but then recognizing the value of physical therapy when we recognized that our population couldn't get to the traditional physical therapies out in the communities. We brought it in-house and increased our utilization tenfold. On top of that, we've recognized, again, our population not having the access outside in the communities. We bring things in-house. Recently brought in mobile dermatology. We did that for not only at Rosen, but we also did it for a school system that we have a partner with. And guess what we found over there? 4 melanomas. So we saved 4 teachers or employees' lives out at that school district. Recently, we brought in mobile vision. We've got mobile mammograms. So anything that we recognize for our specific population, because our population is going to be different from, say, Google's population. Their average age is probably what, 20, 22? And while ours are close to 50, I think we're a little over 50. And we know the lower the socioeconomic status of individuals, the higher the healthcare expenditures are going to be. So if we can keep it contained within our own little house, increase the utilization, make sure that we're focusing in the gaps in cares, making sure those diabetics are controlled, making sure those hypertensive are controlled, that increases the probability that we're going to be able to keep our healthcare expenditures low. Now, just to give you some metrics, because a lot of people are probably out there going, well, yeah, Rosen, you've got the healthier population. Oh, really? 65% of our pregnancies are high risk. Where last year we had 0 pregnancies. Why? Because of programs that we established. And I'll be transparent. When I first came on board, went to my first board meeting, we had a preemie, and I was held accountable for that preemie. But what did we do? We established a program, and that program has been successful for us to manage our pregnancies throughout the entire continuum. We also, Lester, it's not just the chronic care diseases, but we also partner and work with our hospital systems. So we know who is in the hospital every single day. We know who's gone to the emergency room that night. And so that we can bring those individuals, either we get them discharged from the hospitals into more appropriate care, such as maybe hospice or home health care, or to an LTAC or a skilled nursing facility. Why? Again, getting them to the right resource at the right time for the right care at the right price. And there's a whole bunch of other little nuances that we have within our whole ecosystem. And I'm sure we'll touch on that within this podcast.
So Ashley, I'm gonna ask the question that everybody heard after Kenneth describing all of this. That has to be more expensive because of all of the things that's happening. Like, how can somebody do on-site this and give this away and do this and actually it be cheaper? Talk to me about the results that have been able to been achieved.
Yeah, so just at a very high level, Kenneth talked about 33 years ago when we kicked this off. We've evolved into what we are today. We started with this, becoming self-insured, having an independent third-party administrator, and having our on-site clinic. And then we've just evolved into a lot of the stuff that Kenneth was just talking about. But at the end of the day, our costs are half of what our identical demographic would experience in the traditional healthcare setting with one of the large insurance companies. But our benefits are much richer. Usually when you cut the cost of something in half, there's a commensurate reduction in the benefits, but not the case. We have 0 deductibles, 0 coinsurance. And what we figured out is that in the traditional healthcare setting, the last sliver of the healthcare dollar goes to primary care. It goes to the very entity that is trying to prevent all the diseases. And so when we dipped our toes into these waters, we said, wow, that seems quite odd. And so we started investing a disproportionate amount of the healthcare dollar into the primary care, into our on-site clinic, and noticed that we started getting great dividends. A lot of stuff that Kenneth has already talked about, and you'll be hearing. Our folks with diabetes and chronic diseases, hypertension, et cetera, cholesterol problems, we noticed that because they could get care with 0 deductibles and 0 coinsurance, they were going to see the doc more often. And then they built a relationship with the doc and started doing what the doc told them to do. And so our compliance rates for patients with chronic diseases are several times higher than what it is in a traditional healthcare setting. And so what we've learned over the years, you were talking about, I think your question was about financing. What we've learned over the years is every dollar that we invest into this, we get many, many dollars back and higher quality care. Some things that I did not that we did not measure when I said half the cost and zero deductible, zero copays. The thing that we did not measure was turnover. And I've given a few presentations around the country, and when I mentioned we never really measured this, this turnover thing, ours is in the low teens versus our competitors, at 40, 50, 60, 70%. One thing that I was told, and I kind of knew it, but just didn't know how important it was, is HR professionals were going, wow, if we had a low turnover like that, and we did not have to go through the large expense of training people over and over and over again, that would save us a ton of money. And it would also would provide for a better employees with long continuity and that sort of thing. So I don't know if I answered your question, but
yes, sir.
No, I just wanted to piggyback up what Ashley said. With the turnover rates, let's take that, let's push that into a hospital system. I mean, to replace a nurse, it's $60,000. To replace a physician, that's $100,000. And on top of that, Ashley was talking about compliance. In the rest of the world, people can't afford. 40% of Americans are $400,000 away from financial crisis. 50+% of Americans don't even have $1,000 in savings. But here, insurance companies, the BUCAs out there in the world, and employers are out there in the world that are saying, hey, we're going to continue to cost shift. We're going to push it on you, employee. Hey, we'll give you a 4% raise, but guess what? We're going to raise your premiums by 6% and lower your benefits. So at Rosen, we focus on access, quality, service, cost, and innovation. So how do what Miss Rosen has created is, let's give them all the resources, give them all the tools to maximize the opportunity for them to get controlled. So if we've got a controlled diabetic, the national average is $15 or $18,000 for a diabetic. At Rosen, we're in the $5,000 and $6,000 because we're keeping them controlled. If I'm keeping them controlled, I don't have eye problems. We don't have neuropathy problems. We don't have kidney problems. We don't have those other dialysis. I mean, how much does dialysis cost? So we can do a better job in society and healthcare from the primary care world of incentivizing primary care physicians to look at that hypertensive and say, hey, you're not in control. Let's get you the meds. Let's make sure you have access to the meds, that you're taking it, that you have a medication compliance. And we do that. So first, Rosen, you have access to those meds. 90% of our meds, including brand, specialty, generic, are available for free, including insulin. I mean, just the list is the list is lengthy. But then on top of that, we also monitor medication compliance. So we're looking at, here's all our cardiovascular patients, your high cholesterol, your hypertensive, because 75 to 85% of an employer's spend is going to be spent on those conditions, those chronic care conditions. So if we can spend more time on those hypertensives and diabetics and get them controlled, your overall spend will come down. So we at Rosen, we put in these blood pressure systems all over hotels for our employees. And those systems get over 5,000 visits per month, Lester. 5,000 a month. What does that do? It creates awareness of how's my blood pressure doing. It gives us data from the medical center standpoint so we can see, okay, how's Lester's blood pressure been trending? You have to give us access to that information, or you can jot it down and give it to us. But again, that's a different story. But it also has created awareness for some new individuals who just came working for us. And I specifically have some cases where that individual used the machine, and then some of the employees in that department had said, hey, Kenneth, you need to talk to this guy. Brand new member. And the blood pressures were in the 200s, 200 over like 90 or something like that. And that could have been a stroke, but it gave us the opportunity to be able to serve that individual. They've had high blood pressure all of their life. And now here we are able to save their life before they have a stroke. And that's what, 60,000? Or if they live, it could be or more. Correct. So again, it's that access.
So I want to make sure that we don't belittle a couple of stats because, every time I talk to you guys, you say something and you forget how odd and remarkable that is. So 50% lower in costs. Ashley, you said 50%. What does that quantify to, kind of over the years? I know there's a big stat that you guys have is like you've been able to save versus had you continued doing the same thing.
Yeah, so we've saved over $540 million. But I'll say this: that's a lot of money, right? That's a tremendous amount of money. But so much of what we're doing is just providing better quality of care to folks. But going back to the money just for a minute, Orlando, Central Florida, the industry is the service industry. And these are not exactly the highest paying jobs in the world. And so when most plans have an out of pocket, max of, 4,000, 5,000, 8,000, 9,000, whatever, ours is hardly nothing. It's like the equivalent of a pay raise to these folks. So I know we talked about the $540 million. That's a big number, but just think about the average person out there who is utilizing healthcare on a regular basis, who would otherwise have spent a large portion of their annual income on an out-of-pocket max, and they no longer have that burden. I mean, we get stories from people that they just tear up talking about that. And so I love the $540 million number, but man, let me tell you what, I love the 4,000, the 5,000, the 7,000 number even more.
So Lester, I was just raising my hand because it was about a month ago. So myself and the team, we go out to our different departments and just talking about our ecosystem, our healthcare system, make sure that our population understand everything they've got at their fingertips. And I went to a department as a follow-up, and there was an individual, she pulled me aside and one of my associates aside after the department meeting, and she was in tears. And I said, "Are you okay?" And she said, "You guys don't know what you just did for me." And I said, "Well, what happened? Are you okay?" She goes, "Kenneth, the last time you guys were here, you encouraged us to go get the mammograms, go get those things. This individual's, I'll say, slightly above 35, just to maintain privacy. And she went and got the mammogram. What did we find? Breast cancer. She came in and saw our doctor. She has uterine cancer, not a little over 35 years old, Lester. And she was in tears. She's like, "Kenny, I had a radical mastectomy, meaning her breasts removed, and also a total hysterectomy, everything for all of her female parts removed." And she started crying again. She goes, "That's bad. But all my family came around me when I got the little piece of paper with how much I owed, and everybody rallied around me saying, you know what, who cares what it costs? We'll help you pay for this." She goes, "Kenny, I was completely in tears with my family. I paid $100 because she could have the hysterectomy and the mastectomy at the same time. $100 out the door. We saved her life, number one. And number two, she only paid $100.
I mean, if I'm being stereotypic, right, I would imagine your average employee salary 50 or lower.
Yeah, I would certainly think that, yes.
Somewhere, I mean, most of the people are making beds and doing the things that you do in a hotel. And so if you think about that from the perspective of the average deductible and out of pocket nowadays is north of 5,000. When you think about the out of pocket, you're talking about a significant amount of somebody's take home pay. 20%. I mean, I come from a family that filed bankruptcy for healthcare reasons. I can't imagine in that situation having, normally what happens is people have the stress of, can I even have that hysterectomy because I can't afford it? And if I don't, I'm going to die. But if I do, I'm going to financially die. So, I mean, that's just an unbelievable thing. So we talked on the, hey, that everybody wins in our ecosystem. I think I want to transition into that because that is, I think, the reality of the most unique part about the types of programs that you guys obviously do for yourself and now, build for others in the marketplace is this isn't, hey, the big insurance company is coming in to save the day. This is constructed for the needs of the population. And so I kind of view this in a scenario that says, in your type of plan, everybody wins. And I'm going to walk through the everybody wins. We talked about the employee. Your employees get things for free. Their worst case scenario that they're going to pay in any given year is under $1,000. I think it's $750 if I'm not mistaken, right? They're out of pocket that comes out of their paycheck is negligible as well, especially compared to your peers. You as the employer, we heard a significant amount of savings, hard dollar. And then if a CFO is listening, they might think turnover and other things are what we would call soft dollar cost, but turnover, employee satisfaction, et cetera. Now I want to take this and what people probably don't understand. You guys have strategic relationships with hospitals and providers in the community, and they actually give you guys better deals, better financial arrangements than they give to the regular insurance companies. Intuitively, the average person who hears that says, well, okay, let me kind of, I don't get that. They give you a better deal. Why would they take less money? Talk to me about the arrangements that are structured and the benefits of it with the ecosystem partners, more so the hospitals and the providers.
So Lester, when we first started this 33 years ago, and we reached out, to the hospital system that we wanted to partner with in a direct contract, we were kind of looking at what rates that we were paying with our insurance company and just simply trying to get a lower number. We did not know what we were doing. There were not people out there like you who could guide us through the process. And here we are, we're negotiating a raise, and we were going, well, anything lower is better. And then they, I think, somehow overheard us talk about the fact that we had zero deductibles and zero coinsurance. So they were like, what? And we said, yeah, we do zero deductibles and zero coinsurance. And they go, oh, if that's the case, that's a real big game changer, because we did not know this, but it costs a lot of money for a hospital system to collect these large out-of-pockets that we were talking about earlier. And they said, because we did not have deductibles and we did not have coinsurance, that they were willing to significantly reduce our rates. And so, our employees are happy, they're saving that $4,000, $5,000, $6,000, $7,000 a year. We've saved $540 million over the year, and our partner is saving from collections. And so they're willing to take that lower rate.
And I want to make sure that everybody understands this, because, again, I've been in this business my entire career, and a normal person in this business would think this is a conversation about volume, right? XYZ hospital gets way more patients from big insurance company. They must be able to get a better deal than you can get with your, even if you do have 3 or 4 or 5, 6,000 members that you're negotiating on. But I want to make sure people really understand, because, this is back to economics 101 that we learned in college, right? If it cost me, and so the stat I have heard, this is, I don't know exactly if this is right, but that a hospital spends 30 to 50 cents on the dollar trying to collect that dollar. And it makes sense, right? Hey, if I don't have, and Kenneth said the stats, the average person doesn't have $400 in their bank account, and if their deductible is $3,000, well, I'm going to go on a payment plan. I'm going to pay $25 for the next gazillion years. 67% of personal bankruptcies happen because of medical expenses. Most people don't have $1,000 to their name. I mean, that you understand why this is a big deal. So what you guys would normally call a deductible or an out-of-pocket, the hospital calls that an accounts receivable. And if you're reducing their accounts receivable, the way they pay you back is through a better financial deal. Everybody wins.
Yeah.
It's an unbelievable conversation. So I am hoping that eventually 900 hospitals listen to this and get on board with the conversation that says having direct relationships with employers is the way that we're going to fix healthcare, because we all have aligned incentives. The only person that has a misaligned incentives in this is not part of this conversation right this second, because they need to profit. The other folks in that community are people who are not looking to profit off. They're looking to make money and save money and fair, but this is one way. So we talked about employees. We talked about employers. We talked about the hospitals themselves. I want to take a few seconds and talk about the community, because, I mean, if there's anything that, when you get into this business, I think it's a rite of passage that you hear about what Rosen has been able to do with the community. Either one of you, both of you, tag team this. Well, what has been the impact that you have had on the community?
You want to start, Ashley?
Would you like to take that?
Yeah, no, I'll start. One of the things that I love about Rosen is all the philanthropics. Lester, one of my favorites that he has done is he adopted a community, an underserved community called Tangelo Park. It's really close to the Universal area down in Orlando. And that community was just underserved, high crime rate, drug utilization was very high in that area, and he adopted it. What did he do? He established little daycares with preschools for 2-year-olds. He said, hey, if I can start their education early, they're going to evolve and be able to move and be productive in the community. So he actually changed that community from an F school up to, I think it's a B or an A school. He cut crime by 67%. I was just there at Tangelo Park serving lunch to some of the 5th graders, and I just jumped on my little app, and some of the homes in that underserved community, less than 1,000 square feet, is going for over $370,000. So that community has completely changed. But one of the cool anecdotes that I have, Mr. Rosen called me up one day. He goes, hey, Kenneth, I went over to the pharmacy to pick up my prescription, and the gentleman came out and said, hey, are you Mr. Rosen? And he said, yes, I am. He goes, you don't know me, but I lived in Tangelo Park, and you sent me to college, and I'm now a pharmacist. My hair, every time I say that, or if you think about it, my hair stand up. And to see the kids that he has impacted, I think he sent, Ashley, correct me if I'm wrong, over 400 kids to college. Imagine what that's doing to the community as many of them come back versus either being homeless or, working, minimum wage type jobs. Now they're productive. Look at that one who's a pharmacist. I ran into another one. She's going to law school. All of those are changes in the community. He had now adopted another community called Paramore and doing the exact same thing. He established the Rosen School, Elementary School, the Paramore Elementary School, again, providing early education to those kids. Education is what Mr. Rosen absolutely believes in. At the University of Central Florida, he donated, I think it was $20 million to the University of Central Florida, to the Hospitality College. And when I was going there, I think I didn't go to that college, but that college, the College of Hospitality, had about 75 students a semester. He brings it in. He establishes the Rosen College of Hospitality, now has about 3,500 students a semester, and is now #1 hospitality college in the nation and #2 in the world. So he even has beaten his old alma mater, Cornell University. Ashley, you want to grab some of the other philanthropics that he's done?
So just going back to the Tangelo Park and these underserved communities. So he pays for 2, 3, and 4-year-olds preschool, and what he does is offers to tutor those children so they can be all along from 2 years old all the way up to through high school to guarantee their graduation. So graduation rates used to be 50%. Now they're almost 100%, if not 100%. And once they graduate high school, their entire college is paid for: books, tuition, room, board, everything. And that is just, absolutely incredible. But what's so interesting is, if there are two institutions in the country that need to be fixed, it's education and it is healthcare. And so it's just very interesting how the money that Mr. Rosen saved in healthcare, he invested it in education. And his hope is to really change the face of America, not only in healthcare, but change the face of America one underserved community at a time. And so real, meaningful, impactful stuff is coming out of this healthcare thing.
Man, I've heard the story a million times, and it's still like, it's almost unbelievable, right? To really think all that through, right? It breaks so much of the normal thought process about what is possible. So what is possible? So I want to take this to the last topic. So you're Rosen, you're doing this for yourself. You've got your own insurance agency clients that are doing this. So I want to start, kind of with, hey, there are other people doing this, so you've proven the model. But I'd be lying if I wasn't excited about what the future is, about what we were able to launch with Rosen Health. Talk to me, guys, about what the vision is for the future, not only in Central Florida, but the expansion of this whole conversation and impact, as far as it will go.
So we launched Rosen Health recently, and the overall goal for this is to get what we've been talking about here today into as many hands as possible. So, can RosenSure go out and talk to some employers and convince them to do something like this? Absolutely. But we're small. We're not going to be able to impact as many lives as we want to. And so what we're doing is going to employers and to insurance advisors out there and doing this for them. We can be the back office for that advisor who may not be particularly knowledgeable about all the ins and outs of what we've done. And we help them to help their client. And so the main goal is to get this into the hands of as many people as possible. And we think Rosen Health is a vessel to do that.
And when you think about this, Kenneth, and I'll ask you a question and tack on whenever you wanted to. When I think about this, and the reason I'm so excited as an advocate for this and being a part of it is, quite honestly, I got the cheat code, right? I'm a product of the late 70s, so I remember the game Contra, where it had like that up, down, left, right, BA. Oh, yes. And it gave you like unlimited lives. So you got rid of that. You got the cheat, and you started so far ahead in this kind of conversation. Employers and advisors that jump on the Rosen Health bandwagon, they get to start 30 years ahead and tack on to the deals that you already have with the hospitals, all these conversations about your advanced primary care clinics that you have scattered now across Orlando, the mobile this and the mobile that. You have been the mad scientist inside the lab doing it for yourself. Now anybody joining this has the opportunity to just jump on that bandwagon.
Yeah, absolutely. And that's what really excites me, Lester. From the clinical perspective, is we'll be able to help more people. And with our relationship with People One Health, that we're going to be able to put these shared site primary care facilities for employers all across Central Florida and bringing all of the tools and everything, and even take the mistakes that we've made in the past that we've been able to bring forward, and we bring the solutions to these employer groups, we'll be able to help more people in Central Florida. I saw just recently a stat that just breaks my heart, Lester. So in 2023, 54% of Americans were living paycheck to paycheck. In 2024, it's 68%. So let's take the primary care, take the solutions of Rosen Health, bring it out into the communities. Let's improve the benefits. Let's lower the premiums. Let's give the raises to the people that deserve it. And that's what really excites me. Let's help more people. Let's change this. What are we at? 20% of our GDP now? We at number 1 in spend, and number 40 or 38 in quality? We can do a lot better than this. And this Rosen Health, this is the real deal.
And Kenneth, just to tack on to that, 33 years ago when we did this, it was kind of scary. We didn't know what we were doing. We happened to get it right, which was just magical, but we didn't know what we were doing. And now, there are people that can help with that. And so, when for many, many years prior to the 33 years, we kept hoping that we would get, better rates. But what was pretty much the status quo was our agent would come in, advisor would come in, they would say, it looks like a 25% increase. We're going, oh my God, what are we going to do? And then they come back, a week later, 2 weeks later, go, boy, I've been fighting for you. I got it down to a 15%. But that's when Mr. Rosen said, that is not sustainable. So, for those of you who are hoping that it's going to get better, I'm not trying to scare you, but if you keep doing it the same way that you've been doing it, it's not going to get better. And if you have folks out there that can help you through the transition of where you are now and what we're doing, it'll be one of the best investments you've ever made for your company, for your employee, and for your community.
I love it. I think they call it insanity, thinking that doing the same thing and expecting different results, right?
Yeah.
I wanna end it with, there's skeptics out there that heard all this and they're like, once in a lifetime, yeah, y'all are fairly big. You're concentrated all right there. You guys have clients down to 20, 30, 40 lives and up to thousands and thousands and thousands. Talk to me about the different types of employer clients that are doing this. And I just want to leave the audience with a, yes, you heard this right. And yes, you can do this as well.
Yeah, I think the beauty to what we're doing is it allows not only the 10,000 employee employer to do it, but all the way down to 20, 30, 40, and they're in various industries, and we hear the same thing from all of them. Wow, I can't believe my costs have been flat for the last 3 years, or I can't believe my costs have gone down, and my employees are coming to me saying that, oh my gosh, I feel like I've almost got a pay raise because we don't have these these high out of pockets anymore. So it is possible for the average employer to get significant cost reductions and higher quality and everything that we've been talking about today.
And small, but you guys have a partnership with some very large organizations that are public, entities, public sector clients that,
yes,
there's no making more widgets when you're a school district. This is legitimately saving jobs, saving teachers, allowing that. I guess let's just finish with that example, because whether you're private, whether you're big, whether you're small. But this is something that, again, when we talk about the impact that you can have on the community and the slash with the education, a school district doesn't have an endless budget, doesn't have the ability to, draw a bigger profit margin. This is taxpayer dollars. Talk to me about that.
Yes, we had a local school district that we partnered with about 5 years ago, and they were one of the poorest school districts in the state, and they just simply could not sustain any more cost increases. And so we implemented a program like we have now, and had they stayed with the BUCA that they were with, over the last 5 years, they would have spent about roughly $75 million more. And so the savings are absolutely tremendous. And the money that the employee has been saving is, especially for teachers, the folks that are kind of bringing up our next generation of leaders. We want them to be as happy as possible, and they've got a tough, road to hoe just in general. The last thing we want them to be is, not healthy or having to pay too much for health insurance. And so, it was very meaningful for them, and it was the merger of everything that Mr. Rosen is passionate about. It's that healthcare and it's that education, and so we're very pleased to have partnered with them.
Well, we're recording this, and it is past 5 o'clock. I don't think I'm going to be able to sleep because I'm so jazzed at what the future may hold. Gentlemen, if you had to leave the audience with just one thing, so, out there is going to be a business owner, an HR person, a CFO, it could be an advisor. Shoot, it could be somebody that is just an employee somewhere that's like, hey, my healthcare, this was intriguing enough to pick up the phone. What's the, Kenneth, we'll start with you. What's that thing you tell just anybody whose ears are on this or eyes are on this page?
Yeah, just pick up the phone, do something. Just think about the last time that you personally might have gone to the emergency room or had to go pick up a prescription or had to see the doctor. I mean, just think of you personally. Now imagine your associates who are making a fraction of what you make. Do something, because there's a solution that Rosen Health can bring to you specific to your population and your needs.
Awesome. Ashley?
Yeah, again, 33 years ago, it was scary to do, but now, we can assist your advisor, and we know exactly how this is going to feel, and we know exactly how this is going to work. You have a complete understanding of how this transition will feel, and you'll have a lot of extra money in your pocketbook and your employee's pocketbook.
Awesome. Well, guys, this has been fun. I think I could do this every day of my life. Oh wait, that's what I get to do every day, so it's cool. On behalf of everybody that comes behind, right? Like when people ask me what my goal in life is, it's to leave a legacy. And, I'm just me personally. And I hope that when we get this finally recorded and buttoned up, that Mr. Rosen listens to this, because I know I am honored to be part of that legacy and that name. And you guys are two absolute soldiers in carrying this legacy. We're not done by any means, but just on behalf of everybody, thank you for paving a road. Thank you for taking that risk. Both of you have been there for a gazillion years, and you've had offers to go somewhere else. And the fact that there's just such a bigger, the world is bigger than any one of us by ourselves, and that this is something that could unite, like you said, Ashley, like two really broken systems in education and healthcare, and how healthcare and 20% of our GDP could put so much money back in the economy, back in people's pockets. and shoot, save their lives, whether financial lives or health wise. So, on my behalf, thank you guys for being my guest and for the battle you guys fight every day.
Thanks for having us.
Awesome. For our crowd, if there's any time that I have ever asked for you to download this and share it, this is the episode. I don't normally ask. I just kind of feel like, if you feel compelled, but this is one of those episodes, just being able to firsthand see it on my own, with my own two eyes. I have checked into, I think, out of all of their properties, I think I've stayed at 5 of them already. I've seen how happy their employees are. I've seen the Tangelo Park project. I've seen what this does. If there's anything that as just a community and a following of people that just care a little bit more, if there's anything anybody could do, it would just be to download this and share it with everybody because this isn't a function of if this can happen. It's when it happens and how quickly we get there. So guys, thanks so much.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.